Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on histology and physiology of major organs, with 4 answer choices and explanations. Histology and Physiology Clinical Vignette. Liver, hepatic lobule organization. A 42-year-old man with chronic alcoholism develops jaundice and ascites. A liver biopsy reveals centrilobular necrosis, primarily affecting which zone? A. Periportal, zone 1. B. Midzonal, zone 2. C. Centrilobular, zone 3, il canaliculi. Answer C. Centrilobular. Explanation: zone 3 centrilobular is most susceptible to ischemia and toxins, e.g. alcohol, acetaminophen, due to its location near the central vein. 2-2 kidney, nephron physiology. A 30-year-old woman is diagnosed with SIADH, syndrome of inappropriate ADH secretion. Which part of the nephron is most affected by increased water reabsorption? A. Proximal tubule, B. Loop of Henle, C. Distal tubule, D. Collecting duct. Answer D. Collecting duct. Explanation: ADH increases aquaporin expression in the collecting duct, promoting water reabsorption and causing dilutional hyponatremia. Pancreas endocrine versus exocrine function. A 15-year-old boy with type 1 diabetes mellitus experiences recurrent hyperglycemia and weight loss. Which pancreatic cells are destroyed in this condition? A. Alpha cells, B. Beta cells, C. Delta cells, D. Acinar cells. Answer: B. Beta cells. Beta cells in the islets of Langerhans produce insulin, which is destroyed in type 1 diabetes via autoimmune attack. Surfactant production. A premature infant, 28 weeks gestation, develops respiratory distress syndrome shortly after birth. Which lung cell type is deficient in surfactant production? A. Type 1 pneumocytes, B. Type 2 pneumocytes, C. Alveolar macrophages, D. Goblet cells. Answer: B. Type 2 pneumocytes. Explanation: type 2 pneumocytes synthesize surfactant, which reduces alveolar surface tension and prevents collapse, atelectasis. Stomach, gastric secretions. A 50-year-old man presents with pernicious anemia and atrophic gastritis. Deficiency of which gastric secretion is responsible? A. Pepsinogen, B. Intrinsic factor, C. Gastrin, D. Mucus. Answer B. Explanation: intrinsic factor from parietal cells is required for vitamin B12 absorption. Autoimmune destruction of parietal cells leads to B12 deficiency. Heart, myocardial action potential. A 65-year-old man with hypertension takes a calcium channel blocker, verapamil. This primarily affects which phase of the cardiac action potential? A. Phase 0, Na plus influx. B. Phase 1, K plus efflux. C. Phase 2, Ca2 plus influx. D. Phase 3, K plus repolarization. Answer: Phase 2, Ca2 plus influx. Explanation: verapamil blocks L-type calcium channels, reducing Phase 2 depolarization, leading to decreased myocardial contractility and slower AV conduction. 7. Brain, blood-brain barrier function. A 55-year-old woman with bacterial meningitis receives intravenous ceftriaxone. Why is this antibiotic effective in treating CNS infections? A. It binds to astrocytes. B. It penetrates the blood-brain barrier. C. It bypasses the blood-CSF barrier. D. It enhances microglial function. Answer B. It penetrates the blood-brain barrier. Explanade-brain barrier, formed by tight junctions in endothelial cells, selectively permits some drugs, e.g. ceftriaxone, fluoroquinolones, to enter the CNS. 8. Skin, epidermal layers, and wound healing. A 30-year-old man sustains a deep cut on his forearm that extends to the stratum basale. What is the primary function of this epidermal layer? A. Waterproofing. B. UV protection. C. Cell regeneration. D. Immune surveillance. And C. Cell regeneration. Explanation: the stratum basale contains stem cells responsible for keratinocyte proliferation and skin regeneration after injury. 9. Intestines. Nutrient absorption. A 45-year-old woman with celiac disease experiences iron deficiency anemia despite adequate dietary intake. Which part of the GI tract is likely damaged? A. Stomach, B. Duodenum, C. Ileum. Answer B. Duodenum. Explanation: the duodenum is the primary site of iron absorption. Damage from celiac disease impairs iron uptake, leading to anemia. 10. Adrenal gland, cortisol secretion. A 60-year-old man with Cushing's syndrome has elevated cortisol levels. Which adrenal cortex layer is responsible for cortisol production? A. Zona glomerulosa, B. Zona fasciculata. C. Zona reticularis. D. Adrenal medulla. Zona fasciculata. Explanation. The zona fasciculata in the adrenal cortex secretes cortisol, which regulates metabolism, immune suppression, and stress response. Key takeaways for histology and physiology. Liver, centrilobular, zone 3, is most affected by toxins, e.g. alcohol. Kidney. ADH acts on collecting ducts to increase water reabsorption. Pancreas. Beta cells secrete insulin and are destroyed in type 1 diabetes. Lungs. Type 2 pneumocytes produce surfactant to prevent alveolar collapse. Stomach. Parietal cells produce intrinsic factor for B12 absorption. Heart. Phase 2 Ca2 plus influx is blocked by calcium channel blockers. Brain. The blood-brain barrier regulates CNS drug entry. Skin. The stratum basale contains stem cells for skin regeneration. Intestines. The duodenum is the primary site of iron absorption. Adrenal gland. The zona fasciculata secretes cortisol. Would you like vignettes on endocrine gland disorders or gastrointestinal physiology next?